Where do we begin here? I am a neurologist and I have been diagnosed with a brain tumor. So I thought it would be helpful to make some recordings about what I'm going through. So first I thought, what is a neurologist? You know, all my life has been about both learning about diseases that affect the nervous system, including the brain and the central nervous system, and both preventing and treating neurological disorders. A lot of my work is focused on stroke and preventing vascular disease that can affect cerebral vascular disease that can affect obviously stroke, as well as brain health and dementia. And a lot of my work has been focused on prevention of neurological disorders. I've had the privilege of working with both the American Heart Association and the American Academy of Neurology and serving in leadership roles, and it's been a privilege and honor to work with these organizations which really have missions and visions and strategic goals that are so important to the public health and our profession. Well, when this all hit me, you know, as a neurologist, this was probably the first time that I was experiencing a neurological condition. I thought it would be helpful to jot down, write down, or actually record some of my thoughts of what it's like, you know, being a patient. You know, as neurologists, we take care of many, many patients with multiple different conditions, but going through this and being on the other side, I thought would, you know, add some perspective. And I wanted to, you know, share some of my experiences in the hope that, you know, others would benefit and recognize that you're not alone when you go through a chronic neurological condition. And there are many similar issues that occur. And I thought it would be helpful both for myself, you know, as when I told a few people about this, they said it's great to have a catharsis and, you know, to put your thoughts down, and it helps you, your own individual, you know, dealings with this, which is not easy. And then for others. And that's how it started. Sort of, I think I thought of a neurologist dealing with a chronic neurological condition, kind of being a patient on the other side. And that's how it really started. So I think we need a multi-sectoral, professional and organization, you know, approach to brain health. One organization alone can't do it. So if we start first, obviously in the US, to me, AHA and AAN would be great partners to work on this. Could be others. And then obviously there are international collaborations as well. And we need to make it clear to the public what it means, so the public can take control and do something to prevent and improve survival with good brain health, you know? And there's simple things, but we need to become more preventative.
Good morning, everyone, and welcome to the 75th Annual Meeting of the American Academy of Neurology. Those of you who know me know that Dr. Ralph Sacco was a very dear friend of mine. If you've had the privilege of working with or training under Dr. Sacco, you also know that he was a remarkable human being with a kind heart and a wonderful laugh. For those of you who have not met him, Dr. Sacco was the president of the AAN from 2017 to 2019 and a renowned stroke neurologist. He launched the academic initiative here at the AAN to help neurologists examine the needs of academic neurology departments and develop tangible resources and solutions in support of the future of academic neurology. And among a very long list of other visionary accomplishments, Dr. Sacco was a champion of brain health. When Ralph was diagnosed with a glioblastoma in October of 2021, he began imagining how to ensure that his professional societies optimize brain health and promote preventive neurology, the subject of his very own AAN Annual Meeting presidential address to all of you 4 years ago. A month later, he called me to tell me he had left in his will a bequest to the AAN and one to the American Heart Association, at which he served as president from 2010 to 2011, along with a request that the two organizations join forces to advance brain health. He also told me that he was leaving me a personal gift, audio tapes of his thoughts as a neurologist with a brain tumor, to do with as I wished after his death. You just heard one small segment of those clips. A few months later, we decided to move those conversations to videotapes and created a library of them, another small portion of which I am sharing with you today. This plenary address is a tribute to Ralph and his legacy and to the decades of AAN work in brain health that has brought us here to celebrate the 75th anniversary year. To consider the influence and impact that Dr. Sacco and other neurologists have left on this organization in service of neurology, let's go back to the beginning. In 1946, Joseph A. Resch, a neurologist at the University of Minnesota, a resident shown on the left, expressed regret to his neurology department chair, Dr. A.B. Baker, shown on the right, that he would have no association to which he could belong when he became a practicing neurologist and wanted to continue his education. Dr. Baker recognized the need for an organization more inclusive than the American Neurological Association, which at the time had a closed membership of about 250 neurologists. Baker was sympathetic to Resch's concerns. The times were changing. The recent World War had left tens of thousands of American soldiers wounded in body and psyche. Many had brain injuries that required ongoing treatment and rehabilitation. There was clearly a need for more neurologists. If neurology was to move from the shadow of psychiatry and stand as a distinct specialty of medicine, it needed to organize and grow. Baker recruited supportive colleagues to help create and develop the organization, including Francis Forster, Russell DeJong, and Adolph Saas, and together they comprised the four horsemen who were the most instrumental neurologists in founding and developing the American Academy of Neurology. On March 13, 1948, they launched the AAN with 50 members. The first AAN biannual national meeting was held in June 1949 for nearly 200 attendees at a spa near French Lick, Indiana. The setting was chosen not only for its amenities, but for the fact that, after visiting the small town for about 10 minutes, the organizers recognized that there would be nothing to distract attendees from the meeting activities. In all, there were 38 scientific papers presented and 10 scientific sessions held. The content of the program was highly clinical and included the treatment of Parkinsonism, MS, epilepsy, encephalitis, behavioral disorders, and hemiplegia. There were some papers on the basic neurologic sciences and a symposium dedicated to anoxic encephalopathy. By the 1950 regional meeting in Cincinnati, there were some 500 attendees, and due to its success, the leadership decided on full-fledged annual meetings. The Academy soon outgrew the spa concept, and resorts were replaced with convention-oriented hotels and eventually by convention centers like this one. A relationship with the global international community was appreciated by Baker, who had led a delegation to the International Neurologic Congress in 1949, helping elevate American neurology in the world community, establishing the course for future global discourse. Scientific advancement in neurology was also determined to be a priority, so President Baker and President-elect Pierce Bailey lobbied for the creation of the National Institute of Neurologic Disorders and Stroke within the National Institutes of Health to drive federal funding specifically to brain research. Dr. Bailey was appointed as its first director in 1951 while he served as AAN president. The Academy grew steadily over the next 3 decades, and in 1983, Dr. Nelson G. Richards became the first private practice neurologist to become AAN president, bringing an even stronger emphasis to supporting the physician-patient relationship. I had the privilege of working with Dr. Richards when I joined my first subcommittee, the Medical Economics and Management Subcommittee at the AAN in 1999. During the 1980s, the AAN worked closely with other organizations to successfully convince Congress to declare the 1990s as the decade of the brain, which not only increased funding for research, but helped focus public attention on brain health and the need for treatments of neurologic disorders. The AAN Education and Research Foundation was created in 1993 as the brainchild of former presidents Roger N. Rosenberg and Francis I. Kittredge, Jr. We now know the Education and Research Foundation as the American Brain Foundation. In 1996, the foundation initiated the Brain Matters Education campaign to promote the importance of the brain and its functions to the public. And in 2010, I was asked to serve as editor of the brainmatters.org, our first public-facing website. Public education continued to evolve with brain health fairs during our annual meetings and the creation of the patient and caregiver magazine, Neurology Now, in 2005, which was later rebranded as Brain and Life. For almost 10 years, the AAN hosted a public brain health fair during the annual meeting. This was a free, one-day-only event that included fun, hands-on activities and the opportunity for attendees to interact with some of the best and brightest neurologists in the world. Attendees included neurology patients, caregivers, families, students, and anyone interested in brain health and the latest treatments for brain disease. Attendees of all ages were fascinated by the unique invitation to see and hold a human brain. Here's an image of a neurologist in the making from Philadelphia's annual meeting, Brain Health Fair in 2019. These photographs from Vancouver and Philadelphia demonstrate how excited the public was to learn about neurology in so many interactive ways, to meet neurologists and celebrities like Ben Utet, Super Bowl champion and concussion advocate, and participate in the immersive experience of the Brain Dome introduced in 2019. The AAN focused on the prevention of brain injury with free helmet fittings and distribution at the brain health fairs and the bike helmet giveaway program in Minneapolis, one of the most rewarding and fun activities I've ever had the pleasure of participating in over the years. And I wasn't the only one. Everyone loved taking part in these events, especially kids like these who attended in 2014 and 2016, and big kids too. In 2017, Dr. Sacco was interviewed at a bike helmet giveaway by a local news outlet and shared his now oft-quoted statement with the public.
If you wear a helmet, you can prevent life-changing brain injury. So it's all about protecting your brain. It's all about wearing a helmet. As the weather gets better, get out there, wear a helmet. We want you to, just like you wear sunscreen to protect yourself from the sun, wear a helmet to protect your brain.
This was not the first time the AAN headquarters drew public attention. Visitors over the years have been welcomed to the AAN's front door by a sensory garden, a 4-story water wall, and nearly 300 etched brick pavers that call out some of the many brain diseases that need to be cured. To this day, people stop by and leave flowers on bricks in honor of their loved ones. In 2018, the AAN headquarters used its opportune location 1 block away from US Bank Stadium, where the 2018 NFL Super Bowl was played, to reach a large audience with the AAN's concussion awareness campaign. When in doubt, check it out. The month of the Super Bowl, the AAN wrapped 28 windows of the headquarters' first floor with dynamic images representing athletes of all sports, age, and gender. The campaign directed people to the AAN website for information on the AAN Sports Concussion Guidelines and other resources. At the same time, the AAN brought in the winner of the 2014 St. Paul Winter Carnival Ice Sculpture Contest, who brought ice sourced from a Minnesota lake to carve a 7.5-foot tall brain ice sculpture that sat outside the entrance to the AAN. A gorgeous time-lapse video of its creation is still available on the Mill City Times website. It was one of the many headlines describing AAN activities and members' research raising awareness of brain health over the years, and included publications in major news outlets. Many of those brain health stories were about research published in the journal Neurology over the years. Dr. Russell DeJong, one of the original horsemen, helped launch Neurology and served as its founding editor from 1951 to 1976. A.B. Baker would earlier describe DeJong as the most scholarly neurologist in the Academy. Both of them would be astonished at the growth of the publication and its transformation over the years. The publication would feature myriad research studies and personal reflections on brain health in the decades to come. In 2001, with former presidents Bud Rowland at the helm and Steve Ringle by his side, the publication Neurology Today debuted its first issue. It was the same year I was invited to write a practice column for the new publication, and I accepted, not realizing those editors would become my mentors and that eventually the experience would launch a new writing career and introduce me to all aspects of this organization and to members from around the world. Neurology Today would also cover a large spectrum of brain health news as interest in the topic grew over the years. The ways we covered brain health efforts evolved over time as we broadened into other platforms, adding audio offerings for the medical community and the public alike through a library of podcasts. The original Neurology podcast, introduced in 2007 by Dr. Ted Burns, now includes interviews twice a week with authors of the most exciting research articles from neurology. It has had millions of downloads over the last 16 years and is a tribute to Ted's dedication and legacy. The Neurology Minute, a brief daily summary of what you need to know in the field of neurology, the latest brain science, and timely topics explored by leading neurologists and neuroscientists, was launched in 2019 and has had just about 4 million downloads to date. The Brain and Life podcast, our newest offering, has had over 128,000 downloads and includes regular discussions of brain health. Finally, Neurology Today's editor-in-chief, Dr. Joe Safdie, has been providing a podcast overview of topics covered in the latest issue every other week since 2017, now called Neurology Today in 5. Since 2005, we've had dozens of celebrities grace the covers of what was Neurology Now and is now Brain and Life, helping to bring awareness to neurologic conditions and brain health. From Muhammad Ali and Michael J. Fox, who brought awareness to Parkinson's disease, Sharon Stone to stroke, George Lopez to neuropathy, and most recently, Chris Hemsworth to optimizing brain health. The Brain and Life book series, for which Dr. David Spencer serves as editor, was first released with a book on navigating taste and smell disorders in 2010 and has covered many brain health topics, including the challenges of concussion, its latest publication. To reach the Spanish-speaking audience, Brain and Life in Espanol debuted in 2017 with Joe serving as editor. Connecting the public to our brain health efforts has never been stronger. Critical to our brain health work is our ability to affect change. Our organization is the only neurology specialty society in Washington, D.C., working 365 days a year to advocate for the care of the neurologic community. Neurology on the Hill events, in which our members descend annually on Capitol Hill to speak with legislators, included one held last month, which requested that lawmakers fund research for the BRAIN Initiative. When Ralph Sacco spoke of his legacy, he emphasized collaboration, not only with the American Heart Association, but picturing the world of neurology leading together in unison on a mission to improve the brain health of our global society. Dr. Sacco, who had continued to be involved at the AHA beyond his presidential term and became editor of the American Heart Association, American Stroke Association prestigious journal Stroke in 2019, was proud of its work in 40 years of public policy advocacy in order to ensure that cardiovascular health is seen as a societal priority. It was a model, he envisioned, that could be applied to brain health, and indeed, the AHA has expanded its work to brain health. Notably, the AHA has funded more than $520 million in stroke research funding with more than 3,000 grants since 1998. It also funded more than $43 million in research on brain health and cognitive impairment since 2018, with support from the Paul G. Allen Frontiers Group, the Boer Foundation, and others. The AHA also publishes and regularly updates 6 flagship stroke guidelines and multiple scientific statements on brain health. The AHA-ASA Get With the Guidelines Stroke Quality Registry enrolls annually 86% of all U.S. stroke patients at more than 2,500 U.S. hospitals, and now in Mexico, the Middle East, and North Africa. The World Federation of Neurology, an association of national neurological regions representing 123 neurological societies in all parts of the world, led by Professor Wolfgang Griswold, is constantly evolving its efforts with brain health campaigns and its World Brain Days. This year, the focus will be on brain health and disability on July 22nd. In partnership with the World Health Organization, the WFN is creating a global action plan on epilepsy and other neurological disorders. The WFN is also working with the United Nations Economic and Social Council, where it has consultative status to discuss how the UN can work better with non-governmental organizations and advocate for the UN to recognize optimal brain health in the world population. The European Academy of Neurology, led by Professor Paul Boone, has developed key actions around brain health, including awareness and advocacy campaigns informed by evidence-based epidemiological and cost studies on neurological diseases and determinants of brain health. The pillars of the European Brain Health Strategy were published and disseminated to 47 national neurological societies in Europe during 2022. Neurological diseases and brain health were brought to the attention of consecutive EU Council presidencies by the EAN, garnering massive support. The next EAN European Brain Health Summit will take place virtually on May 9th. With its mission to seek fundamental knowledge about the brain and nervous system and to use that knowledge to reduce the burden of neurological disease for all people, the activities of the National Institute of Neurological Disorders and Stroke in the brain health arena under the direction of Dr. Walter Koroshetz include a public health campaign called Mind Your Risks that outlines important steps for managing brain health, a consortium of U.S. academic medical centers, MARC VCID, looking for actionable biomarkers of cognitive decline, a large NINDS-funded cohort study identifying the geographic and ethnic risk factors for stroke and cognitive decline called REGARDS, and TRACK-TBI, a large international NINDS-supported public-private partnership that identifies ways to improve outcomes following traumatic brain injury. Their research has found that insomnia is common after traumatic brain injury and contributes to morbidity and long-term sequelae, adding to the awareness of the importance of sleep for brain health. The American Neurological Association, a far more inclusive organization today than back in 1948, will celebrate its 148th annual meeting in Philadelphia this September. The ANA, under the current leadership of Dr. Francis Jensen, is also engaged in initiatives to advance brain health. It does so by supporting physician scientists in healthcare advances, publicizing brain health advances in podcasts and its journals, supporting research on healthcare disparities, and sponsoring global outreach to support neurology programs in low-income countries. We thank all of them for remarkable work and hope to be able to say one day that our mutual vision for global public awareness of brain health has been realized. Thus far, you've seen the last 75 years of brain health. Now let's turn our attention to what the next 75 years look like. I'm happy to announce that plans are underway to map out what's next for the AAN and brain health. The Committee on Public Engagement, established under my term, designed the inaugural AAN Brain Health Summit in Washington, D.C. last year with a focus on national advocacy. To our delight, September 15th, 2022, was designated as National Brain Health Day. We were fortunate to have had so many organizations participate in the AAN's first Brain Health Summit. Research centers included the Institute for Health Metrics and Evaluation and Center for Brain Health. Governmental agencies included the National Institute on Aging and the National Institute of Neurological Disorders and Stroke. Patient-focused groups included the Alzheimer's Association, AARP, and the American Heart Association, and specialty organizations also participated, such as the American Academy of Family Physicians and the American Academy of Pediatrics. To inform our members and the public of the initiative, the journal Neurology released a special editorial describing the AAN plans for lifelong brain health. It included the AAN Action Plan that was presented at the conclusion of the summit, The plan divides our priorities by epochs, each representing a life stage and emphasizing wellness across the lifespan. The AAN Action Plan will become a roadmap for incorporating brain health into neurologic practice and developing an integrated alliance with brain health care providers in other fields. The AAN will focus on this initiative for years to come. If you want to join our conversation on brain health later today and later this week, please come to a global brain health conversation at 1 p.m. this afternoon at the Head Talks area with invited speakers including Professor Griswold from the WFN and Professor Boone from the EAN. And on Wednesday, there are 3 events you may want to attend: Redefining Brain Health, Advancing Brain Health Equity Through Global Data, which will be discussed at the Practice and Policy Hub Wednesday at 7:45 a.m. If you'd like to hear more about the AAN's action plan for optimal brain health, go to the Innovation Hub Wednesday at 11:30 a.m. And brain health research funding opportunities from the American Heart Association, American Stroke Association will be presented Wednesday at 1 p.m. I believe the future of brain health is bright with promise. Over time, I hope it will inspire coming generations to enter neurology, even call for the creation of a new subspecialty to manage this burgeoning field. It will allow individuals to lead a better quality of life as prevention is emphasized at each stage of life and target diseases like dementia, stroke, and the cancer that took Dr. Sacco's life too soon, as well as those of so many others. As I come to a close, I'd like to thank Dr. Sacco, pictured here 4 years ago at his own presidential address, as well as the Sacco family for dedicating the Ralph L. Sacco, MD, Memorial Fund for Brain Health. I'd like to take a moment to sincerely thank Meet Boston for being one of the initial donors to the Memorial Fund. I'd also like to express gratitude for Dr. Sacco's contributions to the field of neurology and this organization. And finally, I'd like to acknowledge the lives Ralph touched, including those of trainees, mentees, colleagues, patients, family, and friends here today, including Peter Ezrin, Jeffrey Boylan, Gerard Costi, and most of all, his husband, Scott Dutcher. As I conclude my address, I'd like to share with you a few more videos of Ralph Sacco, our former president, and of the Ralph Sacco fewer people got to know.
We need to evolve. And in the words of our transforming leadership group, we need to become the neurologist. The neurologist is a leader in preventative and interventional efforts, an active innovator, embracing new therapies, data-driven, quality and patient-oriented, communicates, inspires, and motivates, and works with the greatest professional organization that advocates for patients and its members. I am confident that if we continue to evolve, and face these challenges, that we will find a better way forward. Neurology has markedly advanced over the years. I hope you've seen that. We face many global challenges, but each challenge provides a new opportunity. Working together, we will find a better way forward. And in the words of Ruth Bader Ginsburg, real change, enduring change, happens one step at a time.
I applaud the AAN for putting this initiative together. I thank President Orly Avitzur, Natalia Roast, and David Evans for taking the lead to marshal many of the amazing assets that the American Academy of Neurology has to really make a major difference in improving brain health for our public.
A lot of the advice was take time, enjoy each day, continue to work and feel productive as long as you want to. And do some meditation.